Welcome. I am here with Jamie, and Jamie is a second grade teacher. And you were telling me that you have a daughter who is in the 7th grade and a son who is in the 5th grade.
Correct.
And they're involved in sports.
Very much so, yes. And yeah, we spend a lot of time at soccer complexes and baseball diamonds, and we love it. But that's kind of our life right now.
And you also said you love to run and garden.
Yes, that's true also.
So the reason I'm bringing this up is because Jamie loves to be out in the sun, as a lot of people do. And there's no reason why we can't be in the sun, but we're going to be talking about some of the issues that she has today. But she is an outdoor person, like a lot of individuals, and so you can still be outdoors, you just need to do it right. So if there was something you could change or improve about your skin, what would it be?
Number one, all the fine lines that are getting not so fine, a little deeper than I'd like to admit. I've really seen that increase over the last couple of years. It seems like once I turned 40, they were there with a vengeance. And I've dealt with rosacea my entire life. And so that would be a wonderful thing to tame, if at all possible. But you know, as I get older, the skin is a little less vibrant than I would like. My hands, I see a lot of wear and tear on my hands. So just a little more vibrancy. But yeah, the fine lines and the rosacea are probably my number one and my number two concern.
Okay. Anything else? You don't have any acne breakouts?
No longer. I used to when I was in my teens and my early 20s. I definitely had some acne issues, but that seems to be a chapter that's been closed, which is really nice.
Any issues with discoloration? Brown discoloration, freckles, anything like that?
On my hands, for sure. And I actually think more around my eyes. It's funny how you don't notice something and then suddenly it's right there. It's almost like a cobweb in the corner of your ceiling that you don't see. But yeah, I'm sure I've got some discoloration as well.
Okay. So, do you think that your skin is more normal? Do you think it's a combination? Do you think it's dry? How would you categorize it?
Not dry. I think normal. Yeah, I definitely.
Okay. So you don't have any areas where you feel like you get particularly oily or anything like that?
Not too much.
Okay,
No.
great. And were you ever a smoker?
No.
You ever a sunbather?
Oh, yes, for sure. In my teens and in my early 20s, absolutely.
So you're outside a lot, you have a lot of exposure, but you're not a sunbather these days. Is that correct?
No.
Okay. So where do you think you have fine lines?
I noticed them on my upper lip, and those are the ones that seem like they've just gotten really deep quickly. I've got, I don't know what it's called, if it's like the jowl lines, but right there along my mouth. And then, of course, around my eyes. Those appeared first. And
when you say round eyes, point to where you mean. So like the crow's feet area?
Yes, exactly. And actually, now that I think about it, I have, when I'm concentrating or squinting at a screen, I can feel sometimes that I've got the two parallel creases in my forehead, right in between my eyes.
So they're little parenthesis lines. Okay. So when you say you've had rosacea forever, tell me when you think you first started to notice it.
Well, when I was a kid, people would comment a lot on how red my face was when I would, run hard or come in from recess or PE. And then that was just something that was always present. Even today, as I mentioned earlier, I run a couple of times a week, and it doesn't matter how far or how fast I go. It could be a really slow pace, and I still get immediately red. And so I've tried different products through the years that have tried to lessen it a little bit, but I still think I just have a reddish complexion.
So tell me, have you been officially diagnosed with rosacea?
A dermatologist did years ago.
Okay.
Diagnose me, yes.
So if you have spicy food or you drink red wine or something like that, do you get even more red? Do you flush and blush?
Yes.
Okay. And when you look in the mirror, And if you look really close at your face, do you see little, what we call telangiectasias? Those are little dilated capillaries.
Yes.
Okay. I'm writing. Okay. And do you ever get what we call secondary lesions? This is where occasionally you get little bumps on your cheeks, but they're kind of transient, like they might be there for a day or two, or they might all of a sudden disappear. You don't get that?
I've never noticed those.
Okay. All right. So when do you think, even though as a child you'd had a tendency to get red, in other words, you had a lot of vascularity in your skin, when do you think that you really started to notice the symptoms being less transient? In other words, the redness was there, you saw the telangiectasia, flushing, blushing, those kinds of things?
I would probably by my mid-20s.
Okay. Now, the reason I ask this is because rosacea in general, the onset is between the ages of 30 and 50, and it can happen less,
Okay.
although sometimes people have what we call pre-stage 1 rosacea. For example, you could have somebody in their 20s, they drink a glass of red wine, and they flush momentarily.
Okay.
Even their chest and their neck can turn red, or there could be spicy food. They flush, but they're not necessarily red all the time, so it may indicate that they have a tendency toward vasomotor instability or rosacea, but they may not really be into rosacea yet.
Okay.
So would you say that you were seeing full-blown rosacea in your 20s, or would you say that you were just kind of seeing the beginning stages of it?
Probably the beginning stages.
Okay. Yeah. All right. So when you say discoloration around your eyes, are you talking about brown discoloration, some freckling? Okay.
Yes.
And how long would you say you've had that?
Again, it's hard to pinpoint. I feel like suddenly I just noticed it one day. I would say probably within the last 2 years, it's really become noticeable to me.
Okay. Okay. And then when you say wear and tear in your hands, I like the way.
Oh my, yes.
You've just been using them way too much.
I do. I'm really rough on my hands. That's absolutely true.
You're talking about more, is it discoloration? Is it texture?
I really veiny. They just look suddenly so old to me. I look down, I think I have my grandma's hands. And a few age spots for sure, but really it's the dryness and the veins that are, I think that just make them look so senior.
Well, you know, I always say your hands give away your age, and I have to tell a quick story. So this was many years ago. I was a teenager, and I was watching some afternoon talk show or something. It might have been something like Mike Douglas. I don't know if you remember that. It's probably way past most people's time, but anyway, or way before. And Elizabeth Taylor was on there. And Elizabeth Taylor had just had a facelift, and she'd lost weight, and she was really stunning. And I remember thinking how beautiful she was, because everybody's always talked about her being the most beautiful woman in the world. And she looked so young. And then the camera panned down to her hands, and I almost fell off the couch because her hands were all brown and veiny and withered. She looked like she was 110 years old. And it was just such a startling difference.
Contrast, right.
Now, fast forward many years later, I don't know, I was channel surfing some night, and I happened to stop on some QVC or channel because Joan Rivers was on there. And she was talking about all of her jewelry. And I saw a hand demonstrating the bracelets and the rings, and I thought, oh, that model's hand is just beautiful hand, really nice and plump and great looking. It was her hand. She was like, I don't know, in her late 70s, 80 years old. And so your hands really can make a difference. So I understand what you're saying. So anyway, so let's talk about what you use currently. What do you wash with in the morning?
I usually use your Marini glycolic face wash.
Okay.
Sometimes I switch it out with an Arbonne cleanser. It's their siesta line, I believe is what they call it. And so those are primarily, oh, actually, no, there's one more. Sometimes I just use the good old Aveeno foaming face wash from whichever supermarket I've been to.
Okay, so Arbonne cleanser or
Aveeno.
Aveeno. Now, is there a reason why you switch off?
Sometimes just variety. I kind of came to my own diagnosis that maybe my skin would get tired of using the same thing every single day. I have no basis for why I believe that, but it's just something that I've always kind of done. I switch off my shampoo every other day with a different one also.
So this is, I'm going to just stop for a second because this is really interesting. Your hair is dead, which is a good thing because we would all be screaming or we'd have to be put to sleep every time we had a haircut. But so you can get buildup on your hair, it's dead. And so oftentimes we do things to remove the buildup. Your face is constantly shedding, changing, it's alive. So it's a little bit different issue. So in general, what you want to do is you want to find a cleanser that really works for your issues and that is able to address some of the kinds of concerns, whether it might be acne or rosacea or fine lines or texture, pore size, all of that. And then if it's the right cleanser for you, you can stick with it. You don't have to feel like you need to change around. Unless there's something that maybe is varied like the time of year, or maybe sometimes people are having some type of a procedure where they would need to change their cleanser temporarily because they might need to use something that's a little bit less aggressive, something like that. Okay, what do you do after you clean?
After that, pat dry the skin, and then I put on a serum and some eye cream.
Okay, and what type of serum?
Oh, again, sometimes an Arbonne one, and again, it's a vitamin C infused one. And then another serum that I've been using lately is called Alina Skincare.
Spell that.
Alina.
And the Arbonne serum, is that more of a, is it like a gel-like serum? Or is it a creamy serum?
It's not gel, so I guess we'd have to go with creamy, but it's
like a lotion?
Yeah, but kind of a real watery one almost.
Okay. And then the Alina skincare serum, is that more of a gel or a very light lotion?
Very light lotion as well.
Okay. Then what do you do after that?
And then goes on the moisturizer.
Okay, and what kind of moisturizer?
Again, I switch between Marini, Arbonne, and Alina.
So when you do the Marini moisturizer, which one are you using?
Gosh.
Is it called Transformation?
What would be another?
Age Intervention?
It could be Age Intervention.
Is it kind of yellowish looking?
Yes, yeah.
Okay. And so, or it could be what, the Arbonne moisturizer?
Yes.
And anything in the Arbonne moisturizer that sticks out for you that you could name that an active ingredient or anything?
Again, like I think that whole line with the cleanser and all of the serum and the moisturizers, it's all the same line. And I do think it's called Siesta. And
I hope not, because that's my trade name.
Oh, okay, then maybe not. Maybe I'm
check that out,
confusing.
Katie.
But it's a vitamin C.
Okay. And then you said, if not the is there another one that you kind of trade around with?
The Alina also has
Okay.
a moisturizer.
And is that one anything in particular, vitamin C or anything in particular?
No, not that I can
Okay.
recall.
And is the Arbonne and the Alina, are they creams?
They are, yes.
Okay. Okay. Anything that you do after that?
Well, it kind of depends on my day. If I'm going to work into the classroom, usually I stop there because the Arbonne, I make sure I use a moisturizer that has a light SPF in it. If I am going about my day at home, I make sure I put on some kind of sunblock. And so the one I've been using probably for the past year is called Goop, G-O-O-P.
It's by...
Oh, no, it's not Gwyneth Paltrow, sorry. It's called Super Goop. So
Super Goop.
Yeah, so I know it's confusing. So not Goop, Super Goop.
Okay. And what's the SPF on that?
50 or 45, it depends. There's a mineral one and then just a everyday use one. And I use them both on my face and my neck and my
Now,
chest.
you mentioned, though, that you don't put these on if you're going to the classroom. Why is that?
Because I'm indoors most of the time. And so I feel like since I'm indoors, I'm not going to be getting that harsh sun. My yard duty this year is before school happens, not during the school day. So I'm just not outside for the majority of the day.
Okay, so one thing we're going to be talking about is that everybody, but particularly individuals with rosacea, because one of the causative factors of rosacea is sun exposure. And it's a really complex disorder. But if you're just going outside to pick up your mail, if you're just driving to the supermarket to pick up something really quick, 50% of the rays go through the windshield of your car.
Okay.
You're even getting a little bit of exposure from UV lighting, but you have to do everything you can to protect your skin all the time, every minute. So it's really important to wear a really good SPF, and an SPF that has certain factors that can actually help your rosacea not exacerbate it. Okay, so what do you do at night? Cleanse with basically the same type of cleansing routine?
Yes.
Okay.
And then it would all be the same, except for I use a nighttime moisturizer instead of a daytime moisturizer.
And so, by one of those brands?
Yes.
So if it's JMSR, if it's Jan Marini Skin Research, is it the age intervention or is it something different?
It's probably age intervention. I think it's all.
Okay.
I should have paid attention. I just look at them so quickly. And
Now, do you anything on an occasional basis? Like, do you ever use a scrub? Do you ever use a mask? Anything like that?
Every once in a while, I'll do a scrub. I would probably say maybe twice a week.
Okay.
And
What kind of scrub?
It's by Alina, and it's just a kind of a soft, gritty cleanser, like pore cleanser, and I use it all over my face. And then I don't really do masks on my own unless I'm going to get a facial, and maybe I might get between 3 or 4 facials a year, probably more like 3.
Okay, good. Well, let's talk about some of the issues that you mentioned, and I'm going to save a couple of them. Let's start off with the fine lines. Okay. So, there's 2 types of fine lines. One, and most of the fine lines we see on our face as we age, is caused by sun exposure. Now, you listening in, you've heard me say this before, but most of the sun exposure that you are going, or most of the damage that you're going to see in your lifetime, when you look in the mirror and you start to see fine lines, and you start to see little brown spots, and you start to see all the things that you said, you looked at that you feel have really happened more in the last couple of years, probably 90 to 95% of that is from sun exposure, most of which happened before the age of 10. At least 50% before the age of 20. So it gets programmed into your skin. It can take 10, 20 years to show up. So the bad news is that as time goes on, you look in the mirror and it's just like almost all of a sudden it's like this cascading effect, because it's all that damage that's been programmed in from way back when. So that's one type of fine line and wrinkle, and that's probably around your mouth. That's a lot of that. But in addition to also, pursing your lips. You're not a smoker, so you didn't get them from smoking. The second, though, is what's called dynamic muscle movement. Now, dynamic muscle movement is something that happens that has nothing to do with sun exposure. It happens to do with expressions. So you could be living in a cave and never see the sun, and if you're making expressions, what happens is it makes a crease in the muscle. You put the skin over the muscle, you see a line.
Right. Okay.
So that would be the little parentheses that she mentioned between your eyebrows.
Right.
And the crow's feet. Now, there's also some lines that go down this way that people get. That we can make a really nice difference with. That's somewhat related, but it's not quite as difficult to address. Those other lines, though, you can spend all the money in the world and you can go with products that claim that they're like Botox. You're wasting your money. We can soften them, but that's Botox.
Okay.
Okay, now, again, not saying that you should run out and get Botox, but just so that you know the difference. And with Botox, the way that Botox is injected today, it's not like, oh my God, it freezes your face. People still move their eyebrows, they still make facial expressions, but what it does is it stops certain muscles that are overworking, but it doesn't stop other muscles. And typically last for about 3 months. And actually, over time, some of the muscles atrophy. So it doesn't have to be done in some people as frequently. But anyway, just so you know. Okay. With regard to the hands, we actually have a fabulous hand product that is being repackaged, not reformulated, but repackaged. So it's off the market right now, but it's going to be back on the market shortly. And what it does is it addresses the discoloration. Okay. It makes a huge difference in the appearance of, that kind of crepey texture that you get. And the other thing is that because it has the ability to address a lot of the aging factors, the skin looks so much plumper. In fact, in some of the before and after photos we've done, it almost looks like people have had filler put in their hands. Okay. Makes a big difference. So we'll keep that in mind, okay?
Okay. I like it. Yeah.
Okay, now, with regard to I want to talk about the discoloration next.
Okay.
So the discoloration is something that probably in your case, unless you have a hereditary tendency, like, if you looked at mom or you were of a certain ethnicity and you had a certain skin type, probably it's pretty much just sun exposure. And it's just kind of the freckling that comes, and it gets worse as time goes on. And so that's a different issue from your rosacea, but you can actually address both of them. And whether we're going to address both at the same time, we may go after the rosacea first, because some of what we're going to do for that actually will make a difference in the overall brightness and the overall evenness of the skin tone. But we can specifically address the discoloration. Okay. So with discoloration, what we have to do is we typically have to address it with two different things. Number one, something called tyrosinase inhibitors. So tyrosinase inhibitors are topical ingredients that actually go after the way that pigment is thrown off. They work with active tyrosinase in the epidermis, and what they do is they just help to even out the skin tone over time. Okay. So one of the ones that people recognize the most is hydroquinone, prescription hydroquinone, which is controversial. So there are other things that we have today that work very, very well. The second issue is that the way that you react to the sun, to a great extent, is determined by a hormone that we all have floating around in our body. And we pretty much all have the same hormone, whether we have dark skin, light skin, whether we're a redhead with freckles, that all we ever do is burn and never tan. And that plays a role in why someone maybe sits in a hot car. There are people that have more pigment in their skin. They sit in a hot car, they pigment. It plays a role in how we react to the sun. So what we can actually do today is we actually have something that can help to address those factors as well. Okay. And that's something we weren't able to do before. Makes a big difference. So we may save that for a little bit later, but what we want to do right now is we really want to deal with kind of the redness and the rosacea, because that's something that can be progressive. It can get worse. Okay, so what I'm going to recommend for you is I'm going to recommend our basic skincare management system, but I want to talk about rosacea for just a moment. And when you were diagnosed with it, did they give you much of an explanation as to what the rosacea and what causes it or any of those kinds of things?
No, not really.
Okay. Well, rosacea is a chronic inflammatory disorder, and it is a disease of vasomotor instability. So if you were going to say that there was a hereditary factor, it's not like there's a rosacea gene, but you inherit your skin type and you inherit your coloration. People with fair skin have more of a tendency to rosacea because their skin is more vulnerable to sun exposure. And it's a disease of vasomotor instability. So blood vessels are supposed to expand and contract, right. Expand and contract. In rosacea, they're compromised. Secondly, with rosacea, it also is a disease of reactivity. So we tend to think of it, a lot of times we're told, oh, you just have really sensitive skin. You could have really sensitive skin and not have rosacea. You could be allergic to everything. You could have rosacea and not be particularly sensitive to all these different products that you're using as an example. You do just fine with the products. So what you are, though, is you're reactive to certain things, and you may not even know what all your triggers are. Big trigger, of course, is sun exposure. Another trigger could be that maybe you get really red, or you tend to flush and blush, or it flares up more when you have spicy food or when you have red wine. Some people it's coffee. Some people it's weird things like chocolate or avocados or berries. And you kind of have to figure that out. Sometimes it's like being in really cold weather, really humid weather. You sit in a hot room and all of a sudden you feel your face get really hot, right. Stuffy room, those kinds of things. You know what your triggers are. Mm-hmm. So what we have to do is we have to sort of address the factors that cause those triggers.
Okay.
Now, you have a protein in your skin, we all have it, it's known as cathelicidin. And that protein is actually really good. It's an inflammatory protein. So if you cut yourself, it's great because it helps in the healing process. You wound yourself, you burn yourself. But if you're producing it for no reason at all, at the wrong time, this is what the trigger is, what we believe the trigger is in rosacea. Okay. So we have to be able to address that. And the good news is that we've got some really good tools today at our disposal. And there's some great medical data behind them. You know, we've done some really good studies. So what I'm going to recommend for you is, first of all, I'm going to put you on the skincare management system. Write this down. You're going to get the one for normal combo. Now, let me talk just a little bit about the system. One of the things that's so critical for you is going to be anti-inflammatories. And believe it or not, the cleanser that you're using some of the time, the Marini Bioglycolic Facial Cleanser, is a glycolic acid cleanser. A lot of times people go, glycolic acid on rosacea? Because they think acid, they think rosacea acid. Right. That sounds so harsh. And actually, glycolic acid is a very potent anti-inflammatory. There's even studies that have been done on this by two different dermatologists at two different universities, where they started putting groups of patients that had rosacea, first of all, on 20% home care products. They had them in 2 weeks doing glycolic peels, and in every single case, they were able to control the lesions that can sometimes occur with rosacea. They were able to lessen the redness significantly, and they were able to halt the progression of the disease. So anti-inflammatories are absolutely critical for you. And also, there's certain factors that are going on in your follicle. We could spend a lot of time on rosacea, but when you use a glycolic acid cleanser, the glycolic is of a molecular size that can get into your follicle. Other cleansers could be really great cleansers. I make non-glycolic acid cleansers that are really great, but they can't get into your follicle. The molecular size is too big. So this cleanser is spectacular for things like rosacea. Okay. The second thing is that the system itself, the lipid-soluble vitamin C, there's actually studies that have been done on acne. There's actually studies that have been done on rosacea in terms of its value as far as the inflammation and the appearance of the inflammation. The other thing is that the third item, which is BioClear, is a combination of glycolic, salicylic, and azelaic acid. Azelaic acid is sold by prescription for rosacea. Glycolic and salicylic acid are highly anti-inflammatory. Physicians use them all the time for rosacea. They're one of their primary tools. In addition, they brighten the skin. They help with pigmentation. They help with fine lines and wrinkles, the appearance of fine lines and wrinkles. All of that, it's what we call resurfacing. And when I use the term resurfacing, which I use a lot, resurfacing is really about addressing whether it's fine lines, whether it's large pores, mild wrinkling, rosacea, mild to moderate acne. It's about making the skin look like it's really been perfected. Mm-hmm. You know, that glowing skin that everybody wants, like red carpet skin. The other thing is that you're going to be using the moisturizer that I'm going to recommend for you. You're using the Age Intervention right now, which is interesting, which is fine. It's a dry skin moisturizer. I'm going to have you using Transformation, which has got a lot of technology in it that is anti-aging technology and is going to make a big difference. And finally, the sunscreen. This is going to be so, so, so important. Our sunscreen is an SPF 33. Now, what you need to know about sunscreens is that you need to wear at least an SPF 30. But the difference between a 30 and a 50 or a 70 or a 90 is infinitesimal. What's important is how they block UVA. So you could have an SPF 70 and it doesn't mean it blocks UVA. And UVA is the part of the spectrum that enters the skin like an X-ray and literally damages your DNA, sets up all kinds of conditions for all kinds of things. It makes your acne worse, it makes your rosacea worse, fine lines and wrinkles, on and on and on. So we want a broad spectrum sunscreen that comes under, that has the highest rating. Sunscreen is an over-the-counter drug, so the FDA regulates this, and we want it to have the highest rating that we can possibly have, which it is. Now, in addition to that, there's a lot of other things in the sunscreen that are going to be really good for your skin. And it has an oil capture system. So you said you're pretty normal, but a lot of times people feel that sunscreens either make their skin feel more oily or they're incompatible with makeup, whatever. So this sunscreen, any place, if you had a tendency to be oil, it can have an unlimited capacity to absorb the oil. Any place where you have a tendency to be dry, it'll make you feel soft and silky. And the important thing is that it's going to help to prevent you from being reactive, particularly to environmental factors. That's really critical. Okay, so do you have any questions? Oh, by the way, what I want to mention is with regard to the discoloration. This is something, what I want to do first is I want to kind of acclimate your skin. I want to see how you respond to the basic system, along with Rosalieve, which is what we're recommending for her rosacea. And then at that point, what we can do is we can sort of fine tune it, and we can add in something specifically for the discoloration, which also will further probably help the appearance of your rosacea. Okay? And it'll be very, very anti-aging as well.
Okay.
But again, I just kind of want to get a baseline. And there's some other things we can do. One of the things I will tell you is that you could tell me a month from now, Jan, my skin is the best it's ever been, and I can take it to a higher level of skin rejuvenation. So you've got some things to look forward to.
Okay, I love it.
Now, do you have any questions for me?
No, I do not.
Okay.
No, thank you.
Sure? Okay. Well, with that said, then we'll say goodbye for now. Don't forget to subscribe. Bye.